for the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. Last October, St. Tammany Parish Hospital announced the creation of a long-term strategic partnership with Ochsner Health System focused on improving access to world-class healthcare, improving quality across the spectrum, and reducing costs for patients throughout the community. Together, these two hospital systems will create the most integrated, comprehensive healthcare network in West St. Tammany Parish. To further explain that partnership and explain what it means for healthcare in our community and what it means to you at home, I'd like to welcome Dr. Patrick Torcson, Vice President and Chief Integration Officer at St. Tammany Parish Hospital, and Dr. Edward Martin, Regional Medical Director for Ochsner Medical Center-North Shore. Welcome to the show, guys.
Yeah, thank you, Christian. Really nice to be here. And nice to be here with my colleague, Dr. Martin. So.
Tell me a little bit about, kind of get people familiar with what each of you do at the respective hospitals. Tell me a little bit about your role.
I'll go first. I am a member of the St. Tammany Hospital medical staff. I'm a physician, and my specialty is hospital medicine. I'm a hospitalist, and that is a specialty that focuses on taking care of complex hospitalized patients. Hospital medicine is the fastest growing specialty in the history of medicine, so having a good hospitalist program is very important for the success of an acute care hospital like St. Tammany. I'm also a member of the St. Tammany administrative team. As you mentioned, I'm the Vice President for Clinical Integration. My role as the CIO is to promote clinical and service quality and information technology, which is all very important leading up to this partnership. And also responsible for participating and helping to set up what's called a clinical integration network that we're going to be talking about soon, that allows all the different physicians on our medical staff, whether they're in private practice or employed by the hospital or our Ochsner colleagues, to work together on a quality agenda to deliver health care across the population.
And Dr. Martin, I know you're kind of Dr. Torcson's counterpart at Ochsner, so give us a little bit of background of what you're doing over there.
Yeah, thanks, Christian. I'm a family medicine physician by training. I went to medical school at LSU in New Orleans and then went up to the University of Alabama to do a residency in family medicine. Family medicine is a broad specialty that takes care of children and adults from birth to the grave, and it's a very rewarding specialty to be in. I still see patients a few days a week, but my main role is the Regional Medical Director of Ochsner Health System's North Shore Division, and I have been in that role probably for about 11 years, and we are very excited to have this partnership with St. Tammany Parish Hospital. Both organizations have been well established in the region for many, many years. I think St. Tammany Hospital has been here for over 60 years, and Ochsner has been in existence for over 70 years. They're both very financially sound organizations, and they both put quality as the most important thing that we look at and try and serve patients. We're both not-for-profit organizations, which means that we exist to serve the community.
Right, and you kind of hit on some of the things we're getting ready to jump into, but why do we do this partnership? Why did we decide to create this union to improve access?
Well, I'll go first. I think it's really quite a success story. As Dr. Martin mentioned, we have two very successful organizations. St. Tammany, well established in the community, just a real focus on a mission focus of caring for the residents of Western St. Tammany Parish Hospital. Ochsner has a long history going back to Britannia Street in uptown New Orleans in the 1940s and being a regional multi-specialty clinic. So it was a strategic decision on the part of both organizations to choose to collaborate rather than to compete. And I think that it was recognized that there was a lot of synergy. There was already a regional presence. St. Tammany was well established as a hospital delivery system in Western St. Tammany. Ochsner already had a very well-developed outpatient network in Western St. Tammany. So for the two to come together and to capitalize on the outpatient presence of Ochsner with the acute inpatient presence of St. Tammany really made a lot of sense. And I think it's going to be quite a benefit to our citizens, our residents, that there's been a choice to cooperate and collaborate rather than to compete in Western St. Tammany.
Right, and this is actually something that you're seeing in other markets too, not just with Ochsner, but throughout the country. Dr. Martin, what are you seeing as to the why behind this? Why?
Well, I think some people who probably are new to the area may think that this is a partnership that just happened, but we have made it official. But however, when I came to St. Tammany Parish back in 1987, I joined a practice which was one of the first that Ochsner affiliated with. It was the practice of Dr. Jerry Keller and Dr. Roy Gregory. And in fact, Pat and I practiced together many years ago in that practice. And the first hospital staff that I joined was St. Tammany Parish Hospital. Throughout the years, we have had Ochsner physicians on the staff at St. Tammany Parish Hospital in many, many specialties. And so we feel very comfortable with that hospital, and we're very aware of the high quality that it represents. And we think that it's a natural progression. As you said, around the country, it's become very difficult for many smaller hospitals especially to kind of maintain their solvency related to reimbursement issues and rising costs and things of that sort. St. Tammany has never really had those issues, which is great, but I think that Ochsner and St. Tammany look at this as a good time to form a really solid partnership with two very strong organizations. And we've looked at this from many directions, and everything we see is positive. We think that we can both be even better together, and that kind of a mantra.
Right, and I think that's a lot of what I get questions about is it a partnership? Is it an acquisition? And it truly is a partnership, as you were saying, Dr. Torcson, that it's collaboration. You know, each hospital will still be each hospital and remain their own identity, but collaborate to improve that quality and expand access.
Yeah, I'm glad you pointed that out, because I think when oftentimes we hear about partnerships or you know, some sort of merger or acquisition, there's a thought that one partner is having to bail out the other. You know, as Dr. Martin mentioned, these were two very successful organizations that were doing just fine with their own quality and performance agenda, financially sound, and it was a strategic choice on the part of the administration of both organizations to capture the synergy that comes from both working together. And so it's really a unique opportunity to go from a position of strength and success and service to even a higher level, and that better together mantra that you spoke about.
Dr. Martin, do you have anything to add with that?
Yeah, I totally agree, and I think that some people will think of some physicians as being employed by St. Tammany Parish Hospital. Other physicians are employed by the Ochsner Health System, but we also are very committed to the community physicians who practice on their own and are not employed by either organization. And we really look at serving all three of those classes of physicians equally, and making the hospital and the system more efficient for the physicians, and thereby more efficient and hopefully more affordable for patients in the community.
Right, and that's the exciting thing at the end of the day is however you slice and dice it, get technical or whatnot, it's all about the patient care, and it's expanding that network of physicians and specialties and subspecialties so that we're providing the most comprehensive network on the North Shore.
Mm-hmm. Yeah, and I think, you know, to follow up on Dr. Martin's point, you know, we know of Ochsner as being a regional or nationally recognized multi-specialty group with you know, hospitals and super specialists across all the different specialties. St. Tammany is more than just an acute care hospital. You know, we have 1,800 employees here in Western St. Tammany, 300 physicians on our medical staff, and entering into the partnership, we wanted to create a structure and a platform that allows for success for all the members of our medical staff, including those that are employed, those that are contracted, and of course our independent private practice physicians, who really are the heart and soul of our medical staff.
And that's a great jumping off point. When we return, we'll be talking about what exactly all that means to you as a patient and how your care will only improve from where it is now.
After meticulous planning and loads of preparation, the instruments are ready. The lights are focused. Introducing the Covington Surgery Center, a state-of-the-art outpatient surgical facility right in your own backyard. St. Tammany Parish Hospital, world-class healthcare close to home.
Welcome back to Healthy Living. As St. Tammany Parish Hospital's strategic partnership with Ochsner Health System continues to unfold, we want to make sure that our patients understand what exactly this means to them. So we'll just jump right into that, and Dr. Martin, we'll start with you this time. What exactly is this meaning for patients when it comes down to quality of care and access to care? What are they going to benefit from?
Well, Christian, I think that that patients will probably be the biggest winners of all in this partnership. There's so many ways that they'll be able to benefit. There's so many synergies that even we're finding out now in the early stages of the partnership. One of the synergies that I think will be very helpful for patients and physicians alike is the using a combined electronic medical record. As you know, a lot of patients go to their doctors now, and the doctor's looking at a computer screen part of the time while he's interviewing them. And an electronic medical record is a very, very helpful technology. Years ago, we had paper charts, and you'd invariably lose a chart, or you'd enter data in the wrong chart. That happens very, very rarely with an electronic medical record. Ochsner purchased the electronic medical record, one of the most popular in the country, called Epic, a few years back, and Ochsner North Shore was the first region within our system to pilot that electronic medical record. So we went live in our clinics in November of 2011, and we went live in our hospital in Slidell in January of 2012. So we've had a few years to get used to using this electronic medical record, and I think the longer we use it, the more impressed we are with it. It, as I say, once again, gives a more accurate representation of what occurs in the office visit, and an amazing thing is that it can integrate with what occurs in the hospital setting. And when we first started talking to St. Tammany, we saw the potential benefits of integrating our systems electronically. And I'll let Dr. Torcson talk about how he envisions Epic being used within the St. Tammany Parish Hospital.
Yeah, I think to talk about the information technology, the first and foremost for this partnership is the quality care that we want to be able to provide to the residents and to the population that we serve. And having an enterprise-wide electronic health record is just a phenomenal tool necessary for that quality agenda. And so we were very excited at the prospect of being able to be on a shared electronic record with Ochsner. That's true integration, and that was one of the goals of this partnership. And I think you mentioned too about the unfolding partnership. Just also want to make a few points that this truly is a unique partnership in the sense of how it was put together, with each organization maintaining its own identity, its own assets, its own resources, but combining in a synergistic way, integrating to be able to change the delivery system so that we could achieve a quality agenda for our patients. The partnership has its own board of directors, it has a joint management committee, and we've seated a physician leadership committee where representative physicians from each organization meet together on a regular basis to talk about exactly how we're going to be structuring the delivery system to deliver care, avoid redundancy and waste, and those are all ways that the electronic health record is really going to get us together on the same platform working together.
Right, and that partnership of shared resources, again, I mean, you're still going to get that world-class service and care that you'd expected from St. Tammany, that world-class service that you get at Ochsner. Really, so it's going to be super world-class service now, no matter where you go. And that's the benefit of those electronic health records, is that if you're an Ochsner patient and you go to St. Tammany, that same record, you're not going to have to worry about a paper file and call in to get information. They're just going to log right in, you're going to have that information at the physician's fingertips. So it's really exciting. I know one of the other things that is really going to benefit patients out of this, and we'll talk about more specifics later in our third segment, but is the access for Northshore patients to Ochsner's world-renowned subspecialists. Something that we've had before, but now it's really going to come to the forefront with the partnership. Do y'all want to explain a little bit about how that's going to impact patient care?
I think that is a very good opportunity for patients and physicians as well in St. Tammany Parish and Western St. Tammany Parish with this partnership. Especially having an integrated electronic medical record. That electronic medical record will not only be integrated between the clinics of Ochsner in St. Tammany Parish and St. Tammany Parish Hospital, but also with all of the specialist records that would occur on the South Shore. So as we all know, some very highly specific specialists, they only practiced at large academic research centers, and of course Ochsner is one of those. And so in the past, to be able to see some of those specialists, the patient would have to drive down to the South Shore, and that probably will still happen on occasion. But now I think some of Ochsner specialists will be rotating up onto the North Shore on a regular basis, and as you said, we can talk about more specifics later.
Right.
But this is a great opportunity for physicians to consult other physicians and help improve the efficiency of the medical system as a whole. You mentioned redundancy and waste. In this country, we spend about $3 trillion on health care, and it's been said that about 30 to 40% of that $3 trillion is waste. And it's waste in the form of having to order tests on several occasions because you don't have access to the original tests or imaging studies. It's waste in the form of space utilization. Hospitals sometimes and clinics have more space than they can fill. And I think that St. Tammany and Ochsner are looking for ways to reduce that waste and certainly decrease redundancy.
Right.
And one thing that I think we all agree on, there's a national healthcare strategy that's really focused on giving better care to each individual patient that comes through our healthcare system, better health for the population, and all of this at lower cost. And I think that we know that our citizens, our neighbors, our families all want local health care on that complete continuum of the preventive care and immunizations for pediatricians all the way up to that super specialized kind of transplant care, transplant as a representation across all the different sites, whether it be in the home, the hospital, the clinic, a skilled nursing facility. And one of the advantages of the partnership is we have now expanded that delivery system where we can all work together and provide all those different services along that continuum of care and meet the triple aim of better care for each individual, serve the population, and do all of this without the waste and redundancy and be very cost accountable.
Right, and the benefit of that is that it really continues to fill St. Tammany Parish Hospital's mission of being able to provide that care right in your backyard, right at home. You don't have to travel for it. It's here. It's in our community. So exciting stuff. Looking forward to our next segment when we're going to talk about more about these subspecialists and some of the key focus areas that we're going to that are going to come out of this partnership initially as it continues to unfold. So we'll be right back.
Which flavor? There's no right or wrong answer. The options are endless and can be as unique as our personalities, be it young or not so young. And when it comes to your family's primary care doctor, we believe you should have plenty of choices too. Exceptional care, custom made for you. Because living here means getting condensed milk every once in a while. St. Tammany Parish Hospital, a world-class physicians network close to home.
Welcome back to Healthy Living. We're talking with St. Tammany Parish Hospital Vice President and Chief Integration Officer Dr. Patrick Torcson and Ochsner Health System North Shore Regional Medical Director Dr. Martin regarding the recently announced strategic partnership between the two hospitals to expand care and make the two hospitals, the most comprehensive healthcare network in West St. Tammany Parish. It's quite a mouthful, a lot that's going on, but we definitely want to focus, as we wrap up our show, on the three priority areas that have initially been set out as key points that we want to focus on for patient care. And that's going to be neurosciences, pediatric subspecialties, and cardiovascular work. So I don't know who wants to go first and talk about what's in the pipeline, but I know it's some really exciting stuff.
Yeah, Christian, we, as you mentioned, we are focusing on those three areas, but there are many other areas that we are looking at as well. As I said earlier, there are so many synergies, and we keep finding those every time we meet, which is very exciting. But in the pediatric subspecialty area, we think we have a lot to offer St. Tammany Parish, and because one of the hardest things, I think, for parents who have special needs children and who have children that need to see a specialty pediatrician, in the past, many times they had to get in their car, go across the causeway, and go to the South Shore for that care. We recognize that that's a hardship in many ways, and so Ochsner would like to bring more pediatric subspecialists to the North Shore. So we have worked with St. Tammany to develop some space, and in the very near future we're going to have pediatric subspecialty physicians rotating up onto the North Shore on a regular basis. We're going to try to bring specialists such as pediatric gastroenterology, pediatric neurology, pediatric cardiology, pediatric general surgery, nephrology, and other specialties that would be of great benefit to help families raise healthy children in our community.
Yeah, it's really a wide range of specialties, subspecialists. That list is really impressive, and that kind of dovetails, Dr. Torcson, I know we were talking during the break, with our emergency department expansion. We're going to have an area designated just for pediatric care in that emergency area, so that'll probably help a lot, I imagine.
You know, and with our focus on population health, the pediatric population is just an extremely important part, sometimes overlooked, part of the healthcare system. And I think that the opportunity for parents and families to be able to stay local and still receive that exceptional and very specialized care that the children often need is important. And to focus on that, part of the current expansion and construction at St. Tammany includes a renovation and expansion of our emergency department that's going to include a specialized emergency department for the pediatric population, and having the specialty and subspecialty backup from the Ochsner pediatric subspecialist will really help to round out that network and that delivery system for that segment of the population.
Right. I did want to talk real quick, kind of shift gears to neurosciences, and actually in our spring issue of the hospital's Heart to Heart magazine that goes out quarterly, we focus on a story with a patient who was at St. Tammany Parish Hospital and was able to have a successful procedure using the two hospitals' Telestroke Program. I know that telemedicine is going to be one area that's going to really benefit from this partnership, and specifically with neurosciences. Do y'all want to talk a little bit about how neurosciences are going to kind of to work, together between the two systems?
Yeah, that's another very exciting area, and Ochsner has been a leader in the region in telemedicine. One of our first programs was our Telestroke Program, and it was instituted by a neurologist stroke specialist, Dr. Ken Gaines. And Dr. Gaines has now overseen the expansion of that stroke telemedicine network to almost 40 sites within Louisiana and Mississippi. And St. Tammany Parish Hospital is one of those sites. So if a patient comes in with symptoms of a stroke to the emergency room, they're evaluated immediately by the emergency room physicians. And if it's felt that they could benefit from the consultation of a stroke neurologist within minutes through telemedicine, they can be connected with one of Ochsner's stroke specialists wherever they are. And they can make decisions and even view the imaging studies of that patient in real time and decide what treatments might be helpful to that patient. And in many cases, those treatments, the prompt administration of those treatments is life-saving and can help drastically reduce any disability from a stroke.
And Dr. Torcson, I know technology is one of your favorite areas. This is a huge thing for us too.
You know, and the Telestroke Program is just a great example of how both organizations were already working together even before the partnership. And you know, we recognize the benefit to our patients from having that telemedicine evaluation. And so in terms of putting the partnership together, that was a key focus to start with the success for stroke care, and now expand that to all the different aspects of what we encompass under neurosciences, to include neurosurgical care, neurologic subspecialty care for various chronic and debilitating neurologic diseases, pain management, rehab. We really think there's an opportunity to co-brand a truly world-class neuroscience institute to take advantage of all the different services that are available between both organizations and offer something truly unique and new to our residents that'll serve for a model for a lot of other service lines as well.
And we have just a few minutes left. I know we have one more area that we want to talk about, which was the cardiovascular specialty area as one of those priority areas initially. What closing thoughts on that?
Well, you can't forget about heart disease, the number one cause of death in the United States. And Ochsner just has a long time reputation for prevention, treatment, all the different elements, research around cardiovascular care. St. Tammany has a very well-established cardiovascular program, and to combine the clinicians that are currently working within both programs and to expand the services that are offered with the different technology and new procedures that are coming down the pike was another great opportunity for us to work together.
Yeah, people come from all over the world literally to have heart procedures done at Ochsner in New Orleans. And with the partnership with St. Tammany, our cardiologists, our interventional cardiologists, our cardiovascular surgeons that live and work on the North Shore can deliver that care here if necessary, but if there are more complex needs, that patient can be immediately plugged into those areas of care on the South Shore. So it is one of those specialties in cardiovascular medicine that I think will benefit St. Tammany Parish the most.
And I say, from a population health standpoint, again, it's not just the high-tech and high-end procedures, but the focus on prevention, so that we can prevent heart disease before it results in a heart attack, which is really one of the goals. And another example of how St. Tammany cardiologist and the Ochsner cardiology team were already working together even before the partnership. So now that the synergy and the augmentation is really only more significant.
Right. Well, guys, thanks so much. I'm sure there's tons of wrap-up thoughts that we have, and those things are going to continue to come to light as the partnership continues to unfold and things really get going. That can always, of course, be found on our website at stph.org or ochsner.org for more information on the partnership. But definitely please check us out, and we'll see you soon.